Hey there, Dr. Steve Edlane, and today I want to talk to you about the clinical considerations for Hashimoto's and the gastrointestinal web. So when you're dealing with Hashimoto's, you have to unwind this whole physiological web of dysfunction and all the different systems and all the different interactions. So one of the things we have to look at you have to look in the question yourself is, are there any clinical findings of impaired intestinal motility? So, can you go to the bathroom? Are you regular? Are you plugged up all the time? Is it 2 to 3 days before you go? I mean, all those things I have to investigate and see how your intestinal motility is, because if there's not a good brain connection into the through the vagus nerve, that might be an issue. It could be a lot of different reasons as to why you don't have good intestinal motility. So that's another thing that we have to look for Hashimoto's. Another one, are there any clinical findings of intestinal permeability? Yeah, when we do a Cyrix test or the wheat tumor from Vibrant, if you have a leaky gut, that's intestinal permeability. That can be a primary cause of autoimmunity. Again, we'll see with Hashimoto's, we'll see a ton of leaky gut and any autoimmunity. Generally, there is definitely intestinal permeability. So yeah, we run the tests to see if you have a leaky gut. Are there any clinical findings of malabsorption syndrome? So one of the things that we check in the wheat tumor is the celiac markers, and if you're positive for that, you could definitely have a malabsorption syndrome for sure. So that's another thing we check, part of the GI Hashimoto's web, a dysfunction. Are there any clinical findings of digestive enzymes impairment? And sometimes we just experiment with that. Hey, does digestive enzymes, it really seems to help my bloat. It helps me break down my food better. And sometimes that's all that takes to really help things out. So that's another part of the web. Are there any clinical findings of dysbiosis or microbiota imbalances? When we do more extensive GI testing, we need to look at the gut microbiome and just see what all the different bacteria look like in there, and just see if there's some good diversity in there. Again, is there any reduction of the microbiome diversity? If there is, we have to increase your diversity. It's very common. We see that with Hashimoto's and autoimmune patients. Are there any indications of intestinal infection? So if there's an underlying infection going on in your GI system, that can definitely drive any form of autoimmunity, especially Hashimoto's. Are there any signs of intestinal autoimmunity? When we run array 5 from Cyrix, we'll actually see if there is intestinal autoimmunity going on. Remember, when you're autoimmune, it's not only going to one area, it can attack other areas. And one of the big areas it can attack is the intestinal stomach and intestine. So we run those antibodies on the Cyrix array 5 for multiple systemic autoimmunity. Are there any clinical findings of small intestinal bacterial overgrowth? So when we do our history, we're looking for different areas through our metabolic assessment form. Is it stomach issues? Is it lack of hydrochloric acid? Is it SIBO? Is there certain things in the questionnaire that tell us, likelihood of maybe some SIBO we need to look into? So that's small intestinal bacterial overgrowth. So those are some of the clinical considerations for the Hashimoto's GI web. Part of a Hashimoto's workup on patients, we have to go through that web of dysfunction. That's the GI web we just went through.